I am announcing the creation of the governor's COVID-19 Winter Task Force.
A plan to create a new task force focused solely on the natural state's fight against the coronavirus. It is an ongoing battle. This comes as Arkansas sets another daily record this week in the number of cases reported. Thanks for joining us tonight at 5, everybody. I'm Bob Clausen. Laura has the evening off. More on that task force in just a few minutes as it develops. We're going to get into it, just exactly what it's going to be made up of. Taking a look at today's case report, though, health leaders logging 2,312 new cases of COVID-19. The state has recorded more than 130,000 cases since March. To date, there has been over 112,000 recoveries. Claire Kreitz joining us now with what's new with this winter task force. It's going to handle the caseload and increase hospitalizations. There are a number of different factors here this task force is going to be looking at, Claire.
Yeah, that's right, Bob. The main focus of this new task force, how to ease the strain on hospitals across the state. Governor Asa Hutchinson says right now the hospitals are able to handle the amount of COVID patients, but if we continue at this rate, he says there could be quite the burden on staff and resources.
I am announcing the creation of the governor's COVID-19 Winter Task Force.
On the heels of a record number of coronavirus cases and hospitalizations at an all-time high, the governor announced a task force that will make recommendations on how to bring the numbers down. The task force will be led by Hutchinson and Arkansas Surgeon General Greg Bledsoe, with input from representatives from the Department of Health and hospitals across the state. The group will immediately focus on 4 key areas. Number 1, coordinating the COVID caseload statewide.
Hospitals are having to manage both the COVID caseload as well as the regular caseload, and we don't want either one to suffer.
Next, how can the state help with hospital resources?
Many of the hospital staff, too large a number, has to be quarantined themselves because of exposure, and so that shortens their work time. It puts strain on others.
Then how can they reduce the number of cases across the state, which Secretary of Health Dr. Jose Romero says goes hand in hand with people following the CDC guidelines.
We need them to wash their hands, wear their masks, and watch their distances.
It makes you nervous.
Sarah McGavran lives in Little Rock and says as the restrictions have been lifted, she sees less and less people doing the simple things.
We've gotten comfortable.
Others in the community, like Taylor Natali,
I personally don't think we need to.
Say we need to keep moving forward.
We have to keep the economy going.
When asked if more restrictions could be put in place if the COVID cases don't drop, Governor Hutchinson says right now that's not in the cards.
You can never predict exactly what the future is going to be like, and you can't rule out anything, but that's not the direction we're going.
The first meeting will be Monday morning at 8 a.m. It will be a closed meeting over Zoom. Reporting live at the Capitol, I'm Claire Kreitz. Back to you.
Claire, thank you very much. If you would like more information about today's announcement and about the state's fight against this pandemic overall, go to our website, krk.com.